Shifting the focus back over to that health front, though, as we continue to track cases here in the U.S., just want to highlight that nationally, things do seem to be improving on the case count front. Over the last 7 days, the U.S. averaging just under 53,000 new cases per day. That's down more than 10% from the week prior. Although, as we've noted, a bit of a lag time here between cases and deaths, 7-day average of daily coronavirus deaths here in America, over 1,000 yesterday. That's the 16th consecutive day that we've seen the country average more than 1,000 deaths due to COVID-19 per day. Obviously, we've been tracking some of those key states here, Texas included, as we highlighted yesterday, showing improvements on the case count front, but not equally across the state. And here to discuss that, as well as how the nation continues to grapple with the pandemic. Joining us right now is Dr. Dona Murphey, Director of Scientific Affairs at CortiCare, as well as a neurologist and neuroscientist in Pearland, Texas. And Dr. Kim Murphey, first off, just want to highlight, I mean, we talked about this yesterday on the show, but obviously we've heard from Governor Abbott talking about needing to get the state's positivity rate down to kind of stop this reversal that we've seen in opening up in your state. The test positivity rate would need to come down below 10% to get back there. We've seen it average around 20% last week. So what's your take on how Texas is really dealing with this and getting a handle on it now?
I mean, I think the thing that is at the top of everyone's minds at the moment is school openings across the state, given what the rate of community transmission is in most places in Texas. We, I think, are setting ourselves up to rapidly cycling opening and closures if we open at this time, because we will have a bunch of people going back to school, many of whom probably already have COVID or will be infected prior to starting school. With in-person instruction, we'll spread that infection very rapidly. And we will then see that teachers will get infected, will be unable to provide in-person instruction. And then once the school districts realize that we have to scale back and actually move to remote learning, which is really what we should be doing to begin with, they will be in a tough spot, because the teachers then won't be available to even provide that manner of instruction. And not to mention that, we know that the students who are older are as susceptible to contracting this disease, and so we'll have illness also among older students. So I think that this is going to be a tremendous burden. So we're seeing declining numbers right now, but I think that this will just make us increase again, unfortunately, and we'll see our ICU capacity, increase the number of people occupying those ICU beds increasing again. So, I mean, I think really we've had a lack of leadership here in terms of just making the decision that we need to work very hard on ensuring that our public health infrastructure is able to manage in terms of testing capacity and contact tracing capacity. This proposition of containing the infection at a lower level. And when you have lower levels of community transmission, you don't have to be so fixated on things like hygiene and the masking and the distancing that have become so politicized, right?
Yeah.
So,
well, I want to hit on that point, though, because I mean, if what you're saying is true, and I mean, I hear the warning here when we talk about Texas, admittedly moving too fast. We saw Texas shut down indoor dining and restrict the amount of people that would be able to go into restaurants, kind of an admission from the governor that they moved too quickly. If what you're saying, it sounds like you're saying that that's going to happen again if you open up schools there. We got the update here, New Jersey, and their announcement in terms of opening up the idea that schools might not have in-person teaching, saying that the option to offer all virtual classes will be there on the table. But obviously New Jersey's positivity rate is way better right now than Texas. So you're saying that this is a guarantee that Texas will inevitably have a negative outcome here if they do open schools the way they're planning?
Yeah, absolutely. There's no question. I think that physicians are uniformly in agreement that when community transmission is this high, we are setting ourselves up for failure, a lot of death, a lot of devastation, a lot of untold disability.
But why do you think that is, that this would be the case? I mean, it seemed like Governor Abbott was starting to understand that you can't move too quickly when your stats are that bad. Why do you think that they would be setting up to make the same mistake twice?
I mean, I can't say for sure. I mean, I feel that it at least in part is maybe politically motivated. There is a lot of public pressure, I know, from parents who want to send their kids back to school. In some cases, of course, it is that there is actual real vulnerability for those children in terms of food and housing insecurity. And I really, am sympathetic to that. And I think that it's incumbent upon us to, as people living here, and then also our governments, to come together in order to meet the needs of those students and those families, but also to not reopen, right? To do that in the context of not reopening our schools to in-person instruction until we are doing this in a coordinated fashion with our local health authorities, and understanding that this is happening not when community transmission is so high, but when we've got it under control.
I mean, that's the thing. We're all on the same page. We understand. We've heard this discussion too when we talk to doctors about, treating patients as well. There's a real downside to just locking down. We know the cost of locking down. Schools are no different. We know that a lot of kids depend on lunches and other things to get that they get at school. And the Trump administration is going to be unveiling new measures to safely open schools. I'm not sure how much can be done from a federal level when we think about how this is impacting localities specifically. But shifting back to Texas and what you guys have seen over there, as we discussed yesterday, it's not just watching some of these large metropolitan areas when we think about Dallas and Houston and how those seem to be, at least in Houston's case, moving in the right direction. But on the fringe parts of Texas, it seems unique in the battle that's going on there when we think about immigration and how some other states might not need to worry about that as well. Some interesting reporting from ProPublica and the Texas Tribune highlighting some of those issues when we think about detention centers. How might that also be a key element here when we think about Texas and the risks in breaking down on the progress they've made?
Yeah, the state of Texas has been historically enamored with the prison immigration and industrial complex. And we incarcerate about 40% of the immigration and customs enforcement population here in Texas, and that's really no different during COVID. There are still tens of thousands of people across the United States who are in ICE custody. In these detention centers, which we've known since the very beginning of this pandemic would be exceedingly problematic because they are confined spaces that are poorly ventilated, that are very crowded. And just like we've seen in the prison outbreak, for instance, in San Quentin in California, the same kind of thing is happening in immigration detention centers all over the country, where you have rapidly spreading infection, people who are being transferred between the facilities, who are introducing the infection into new facilities, and then also the staff who are going in and out between the community and the facilities are bringing in the infection, and then also really accelerating the transmission of the infection when they go back into the communities as well. And so, we have a lot of problems with that here. I would say additionally, we are a border state. And so apart from the people who are in immigration detention facilities, we have also the people at the border who have been chronically medically underserved. And that's why we're having the problems we're seeing at the border.
And lastly, I just want to back up too, because I know not all of our viewers live in Texas, but this is something that's playing out, in every state right now. And every state is hoping for progress on the vaccine front. We got the update yesterday from President Trump announcing that the government's going to be purchasing 1 million doses from Moderna's experimental coronavirus candidate, which is in late-stage human trials. We see a few in phase 3 trials here. But what's your take on how the government continues to make these bets? What we know about the timeline, according to Dr. Fauci, for getting these here, if we're going to be waiting until the back half of 2021 for most of the population to have them, what does that say about getting a control of the pandemic right now through the methods we know work, like masks, improving testing, and other things like that?
Absolutely. Yeah, no, I think that unfortunately, the way the public consumes information about vaccine development and technologies that can hopefully help to mitigate the harm of this disease, right, is that we rely on that or the hope of that as something to substitute for tried and true public health measures, as you mentioned, right? And these things we could be doing that are so much simpler and so much less expensive. We aren't even doing those things. And what I fear is that people will attach hope to these things that may not materialize or may not materialize in the way that we hope, and that we will really lose an opportunity to save lives and to reduce the harm to our communities.
Yeah, I don't know if it's just an American habit here when we think about what's been going on with our healthcare system to maybe potentially put a little bit more faith in being preventative about these things. Perhaps it's just how we've been trained. But Dr. Dona Murphey, Director of Scientific Affairs at Corticare, appreciate you taking the time to chat.
Thank you so much.